got some bad news. It can cause ventricular tachycardia. Like, what are you talking about? We're using it to treat ventricular tachycardia. Unfortunately, these antiarrhythmics are also pro-arrhythmic medications. So although we're using to treat ventricular tachycardia, it can also predispose patients to ventricular tachycardia. And patients can also develop pulmonary fibrosis, which is very, very, very rare, or bone marrow aplasia. Okay? Bone marrow aplasia. But this is very rare. And pulmonary fibrosis, which is also rare. Okay? So, the next drug is going to be mexiletine. Now, mexiletine basically works exactly like the same thing as the same class 1B. And there's really not much we need to talk about except just a few things for the boards. For mexiletine, just can cause nystagmus and also can cause thrombocytopenia, pancytopenia. Okay, which means you can develop agranulocytosis, leukopenia, and thrombocytopenia. Which means all the cells are down in the body. Low white blood cells, low platelets, low platelet count. Okay? And the granulocytes are not working properly because they're not being made in neutrophils. Okay? So that's all you need to know for mexiletine. Now, there's one more drug that actually is also it's actually a 1B. But it's a very important drug because we're going to run into that drug in the nervous system pharmacology. It's known as phenytoin. It's a very, very important drug, and it's an anticonvulsant, but it actually is a class 1B. And I would just like to kind of talk about it real quick. Phenytoin, okay? Phenytoin is a class 1B drug that basically blocks and inactivates sodium channel blockers. We use this drug a lot for patients that have seizures, okay? Patients that have seizures, you use this drug, it can block the sodium channels in the brain and slow down that increased hyperactivity of the nervous system, especially the neurons that are misfiring. Unfortunately, the drug can also cause so many side effects. And one of the side effects that can cause in the brain, okay, it also can cause nystagmus. And this is actually pretty impressive. If you ever see a patient overdose on Dilantin or Phenytoin, sorry, Dilantin is just the brand name, but don't memorize that for your boards. Phenytoin is what you need to know. Nystagmus, and you see that patient's eye kind of like flickering like that. That's a very, very important side effects of Phenytoin, okay? Also, the patient can develop ataxia. And then if you look at their gums, they develop gingival hyperplasia, which means their gums are really, really huge and swollen gums, you know? Like the gums are just really huge and swollen. And this is their teeth. Okay? So they develop gingival hyperplasia. So I want you to remember that. That's very, very important. Nystagmus, very important. Gingival hyperplasia, hyperproliferation is one of the side effects of Phenytoin. Okay, it's an anticonvulsant. Okay. Also, it's a drug. It's also used to treat digoxin-induced atrial and ventricular dysrhythmias. So you can actually use Phenytoin to also treat digoxin-induced atrial and ventricular arrhythmia. Okay, I just kind of want to talk about that real quick because next time I'm going to be talking about this later on in full details on Phenytoin in the nervous system. Now, Let's now move on to the class 1C. Finally, for prostitution? Really? Finally. So what drugs are we talking about for prostitution? The flecainide. F stands for flecainide. And P stands for propafenone. Okay, propafenone. That's the drug that's actually for prostitution. This is a 1C. Now, 1C medications also works to block sodium channels in the Purkinje cells. The Purkinje cells inside the heart. That is where they work. And thus, they shorten the action potential duration. But they're not done yet. They also block potassium channels in the ventricular myocyte. So they're doing two things. Class 1C. They block sodium channel in the Purkinje fibers, but they're not done yet. They also block potassium channels in the ventricular myocyte. Okay? So overall, they have a minimum effect on the action potential. Minimum effect on action potential. So if we had to draw a graph for class 1C, 1C medications, let's use a different color so we can be able to trace it. We haven't used purple yet. So for class 1C medications, they pretty much look similar to 1B. Okay? Pretty much similar to 1B. Okay? So, the first drug is flecainide. And we already talked about the mechanism of action, flecainide. So what do we need to know about flecainide? Well, it's also used to treat supraventricular and ventricular arrhythmias. Supraventricular and ventricular arrhythmias. Okay? And we already talked about the types of ventricular and supraventricular arrhythmias. Also, let's talk about let me make sure I'm spelling that right. Propafenone. Okay. Propafenone has pro-arrhythmic effects. It basically works exactly the same way, and one of the side effects of the medication, it can cause bronchospasm. Bronchospasm and bradycardia. Now, the reason why it does that is because it acts also almost like a beta blocker, because it can also block beta receptors. Also has beta adrenergic receptor blockage. Now, let's summarize what we've learned. We've learned about class 1 antiarrhythmic medication. Now, we said class 1 is broken down into A, B, C. If we were to summarize it and what are the high yield information you really need to focus on for your boards is police department, the Procainamide, the quinidine, and also the disopyramide are the 3 type 1A medications. They all block sodium channels. Okay? They all block sodium channels the exact same way. They decrease the influx of sodium inside the cell. Now, for Procainamide, lupus-like syndrome, you must remember that. Very, very super high yield. Okay? Disopyramide, there's not really a lot you need to really come into memory, but just know the drug is part of the class 1A. Quinidine, very important, chinchonism, anticholinergic side effects, the whole blurry vision, constipation, dry mouth. Remember that. That is very high yield information for your boards. Now, remember all three can be used for supraventricular tachycardia, and ventricular tachycardia, ventricular arrhythmias. And that's pretty much it for them. And then we go to the little man. The little man, we look at tokamide, lidocaine, and mexilatin. So we said lidocaine is a local anesthetic, right? And can block, they all block sodium channels. However, lidocaine can cause nystagmus and toxicity. Okay, lidocaine is also used for treatment of digoxin-induced toxicity. Digoxin toxicity, you give them lidocaine. It's also another thing you can use. And also remember, tokamide and mexilatin and lidocaine all use the same mechanism of action. Okay, now class 1C, flicamide and propafenone. Basically, they're also sodium channel blocker. They can be used to treat supraventricular tachycardia, ventricular arrhythmias, and ventricular arrhythmias. But propafenone is the only one that has a beta blockade effect of bronchospasm and bradycardia. So now we've talked about class 1 drugs. Let's move on and talk about class 2.